Shall we begin? Let's begin now.
Hi guys, this is Carolina Diamond, Epiphany of Change. I am Dr. Rogers. Before we get started with this video, if you happen to like the video or the information that is being provided on this video, please press the like button and share with others. If you're new to the channel and you haven't subscribed, don't forget to hit that subscribe button as well as that notification bell. So I was tasked in creating some literature for an organization concerning anxiety and the coronavirus. So instead of just creating something for their organization to use, I decided to also create something of a smaller version for my YouTube viewers. That way the information can go around. It won't be a complete list of all things involving the coronavirus disease or anxiety, but it'll be enough to give you some type of understanding and hopefully ease some of the anxiety that is being caused by this virus. The most important thing I think will help ease some of the anxiety that is stirring up from this is to just give people factual information.
We need to have someone in charge of making sure that as many people as possible across this country have access to getting tested as soon as possible. Who is that person? Is it you? Is it the vice president? Can you give us the name of who can guarantee that anyone, but especially healthcare workers who need to be tested, can be?
As I tried to explain to Congressman Green, from the CDC perspective,
Okay, I'm asking
I
for a
was
name.
trying to say that the responsibility that I have at CDC is make sure all the public health labs have it, and they can make the judgment on how they want to use it.
But they're referencing people who have been advised to be tested to you, and they've been turned down. So is it you?
As I said, I'm going to look into the specifics.
I know
of
that.
there.
So basically you're saying,
for
reclaiming my time, basically you seem to be saying, because you can't name anyone specifically, that there's no one specifically in charge that we can count on to make sure that people who need to be tested, healthcare workers or anyone else, there's not one person that can ensure that these tests can be administered. Yes or no?
My colleague is looking at me to answer. Here we go.
Okay.
All right. So,
And I do have another question, so if we can kind of get
so
to
very
the meat of the
quickly,
question.
the system is not really geared to what we need right now, what you are asking for. That is a failing.
And a failing, yes.
It is a failing.
Very
Let's
much so.
admit it. The fact is, the way the system was set up is that the public health component that Dr. Redfield was talking about was a system where you put it out there in the public and a physician asks for it and you get it. The
Okay.
idea of anybody getting it easily, the way people in other countries are doing it, we're not set up for that. Do I think we should be? Yes, but we're not.
The video that I just showed represents one of the concerns of many that people have involving the coronavirus disease. People want to know, where can they get tested? When can they get tested? There are some who have been denied testing. People want to know why. People want to know, how can they catch this? How can they protect their families? How can they protect themselves? People just have questions, and those questions tend to bring about anxiety, and people that don't usually struggle with anxiety on a day-to-day basis. What's really important about this is those people who already struggle with anxiety and trying to help them find a better way or have a better understanding of what's going on, in the hopes that it will decrease some of that anxiety when it comes to this particular disease. So the CDC is responding to an outbreak of respiratory disease called the coronavirus. It was first detected in China, and it has now been detected in more than 100 locations internationally, including the United States. On January 30th, 2020, the International Health Regulations Emergency Committee of the World Health Organization declared the outbreak a public health emergency of international concern. On January 31st, 2020, Health and Human Services Secretary Alex Azar declared a public health emergency for the United States to aid in the nation's healthcare community in responding to this virus. On March 11th, it was characterized as a pandemic. So with us knowing that we have a pandemic on our hands, then it's important for us to educate ourselves on what's going on with this virus or disease and what we can do to help protect ourselves, our families, and our communities. So the CDC suggests that Americans should be prepared for the possibility of an outbreak in their community. The community can take measures to help reduce the spread of the virus. Currently, a vaccine or drug is not available. Community-based interventions such as school dismissals, which you guys saw on the video, event cancellations, which you guys saw on the video, social distancing, and employee work plans so that people can do telework or work remotely from home can help slow down the spread of this virus. We can practice everyday prevention measures like frequently washing our hands, staying at home when sick, and covering coughs and sneezes. But there's always more that can be done. So when it comes to doing those smaller things, these are things that can also help reduce some of the anxiety that comes along with the thought of the spread of this virus. These small steps that we take to help prevent spreading, or at least our part in spreading the virus, these are the same measures that will also help reduce some of this anxiety. So this is what we're going to go into. Education and prevention are crucial in controlling anxiety during this time. So we're going to go over some steps from the CDC to help prevent this illness. As stated before, there is no vaccine to prevent this disease. The virus is thought to spread mainly from person to person between people who are in close contact with one another, usually within 6 feet, through respiratory droplets when an infected person coughs or sneezes. Older adults and people who are having severe or chronic medical conditions need to take more precautions. In protecting yourself, you need to wash your hands. Avoid touching your eyes, your nose, your mouth. Avoid close contact, especially with people who are sick. You need to take steps to not just protect yourself, but to protect others. If you are sick, stay home. Cover your mouth when you cough and sneeze. Use tissue, and when you use it, throw that tissue away. Use hand sanitizer, people. Wear a face mask if you are sick. You are the one that needs to be wearing the face mask. If you're not sick, you don't need the face mask. Save it for the people that are actually sick to keep them from spreading anything that they could possibly have. Make sure that you clean and disinfect. If you're not doing it already, then make sure that you are properly cleaning and disinfecting things around your house, and use the right tools. This isn't about making up products to use. Use the right tools. The right tools for your physical health. And finally, the right tools for your mental health. Remember that a little anxiety doesn't hurt. So here are a few things that you can do. First thing is limit the number of sources that you use to get your information, because it can become overwhelming to someone that is already dealing with anxiety. Pick a reliable source, start and finish there. Second thing, try to look at things on a local scale. Don't worry about what's going on in China, Japan, Italy, wherever. Focus on what's going on around you and what you can do with what's going on with you at this current time. Practice slow breathing. A lot of times with anxiety, we start getting anxious and our breathing speeds up. So we have to deliberately slow down our breathing. If you need to count from 10, if you need to count from 5, whatever number you need to use, just do that. And as you're counting, you want to breathe in slowly. And then you count as you breathe out slowly. Again, practice staying in the moment. A lot of times we catastrophize and we see things as the worst possible thing, and we have the worst possible result in our minds. Stay in the present moment and focus on what's going on that's positive right now. Try to get yourself back to the place where you are right now, not what could possibly happen, the worst of what could possibly happen. Focus on what's going on right now. And then that goes into challenging your anxiety. Challenge the way that you're thinking. What is causing you to be so anxious at this very moment? We know that there is a pandemic going on, but we also know that we have been given tools. We have been given information for us to try to combat this thing. So try to stay in that moment and keep reminding yourself of those things. Focus on the things that you do have control over, but don't let those things consume you. If you find yourself getting to the point of consumption, then you might want to go and practice some of those breathing exercises. Go and meditate. If reading helps calm you down, go find a good book or a good magazine to read. Some people like doing puzzles. Find you a game that you like playing on your phone that doesn't cause any more stress. Anything that you can do to get your mind off that anxiety at that particular time. Work on those things. Let your mind, let those things draw your attention for the moment. Even if it's temporarily, that'll give your mind, your heart, your body time to basically reset, calm down, so that you can focus on the things that need to be focused on. So when it comes to this coronavirus disease, the way that you would handle anxiety is no different than the way that you would handle it with any other circumstance or any other situation. Remember to focus on the things that you have control over. Try not to make situations seem bigger than they are, but don't minimize them to the point that they don't matter. But just focus on the things to help keep you and the people that are around you healthy. So I gave you guys information straight from the CDC that is public information. You can go to cdc.gov and get that information. Making sure you wash your hands, making sure you sanitize, disinfect, cover your mouth when you're coughing, when you're sneezing. If you can't, cover your mouth with your hands, use your inner elbow. Just doing those simple things and just staying prepared. Wearing masks if you're sick yourself to try to protect other people and yourself. Just those things that you have control over. Let that give you some type of peace and calmness in all of this that's going on right now. So I wanted to give you guys this information. Hopefully it helped you. If it did help you, please click that like button if you can. And please share this information if you think it'll help someone else. And again, if this is your first time to my channel, please subscribe. And when you subscribe, please hit that notification bell. And I'll see you guys next time. Thanks for watching.